Hello friends, I am Dr. Mihir Parekh. I am a consultant neurologist practicing at BAPS Hospital, Vadodara. Today I am going to tell you about migraine. So migraine, in Gujarati we also call it Adha Shishi. So what is migraine? So migraine is a recurring type of primary headache. It causes moderate to severe amount of pain, generally over one side of the head. The pain is generally throbbing type or pulsating type, and once it starts, it lasts for 4 hours to 72 hours. Sometimes patient also can have nausea and vomiting during the episode. So the headache of migraine is classical in the form of it has certain triggers in the form of loud noise, bright or flashes of light, skipped meals, lack of sleep, strong smells, certain foods in the form of chocolate, excess caffeine, alcohol, fermented food, yeast, that can also trigger the migraine attack. Apart from this, change in the environment, hormonal changes in women, these are also additional triggers for migraine. How migraine is diagnosed? So migraine is diagnosed by proper history and physical and neurological examination by a neurologist. So after the history and examination, if the diagnosis is clear, many times patients don't require MRI or CT scan. Why it is important to diagnose? Because many patients is wrongly labeled as cervical headache, headache because of sinus, headache because of gastric problem or eye problems. So proper diagnosis is needed for treatment of the condition. Now once we diagnose migraine, how we should treat it? So treatment is basically involves 3 layers. Most important part for migraine treatment is muscle relaxant exercises, meditation, yoga, even walking and mild exercise is proven as per American migraine guideline. It will reduce the frequency of the attacks. Second important thing for migraine is avoidance of triggers, proper sleep, food on time, and avoidance of the triggering factor like loud noise, excessive bright light, the foods which trigger the migraine. That can also help in controlling the migraine symptoms. And third, treatment. When medicines are involved, there are 2 types of medicine. One is called pain relieving medicines. These are needed when patient have acute attack of migraine. The headache is that much severe, you need to take some medicine to avoid the attack. And seconds are preventive medicine. If your headache frequency is more than 3 to 4 times per month, or your headache is too much severe, even if it is once a month, you have to take leave from your work, you require treatment with preventive medicines. Once you take the preventive medicine for 3 to 6 months, your severity and frequency of migraine reduces. So my take-home message is, if any patient who is having headache, which is of migraine or other type of headache, they should consult a neurologist so their symptoms and their headache can be properly diagnosed. And if it is migraine, it can be properly controlled with medications. Thank you.